Interviewing techniques. When we listen to the patient, we should not only listen to what they are saying, but also to the sound of their voice and its tone, speed, and strength. We should also observe their body language, posture, and eyes, speed and strength of their body movements. These things are not an aspect of this diagnostic pillar, but interviewing the client gives us ample opportunity to observe the person. It does require a degree of multitasking to focus intellectually on the conversation and the information that is being given, whilst trying to observe visually and listen to the more subtle diagnostic signs emanating from the client. Interviewing the client is perhaps the most accessible of the four diagnostic approaches, but it can also be the most difficult because it is not always easy to get the information you need from the client. This may be because the client is not particularly aware of their bodily functions. They may consciously or subconsciously not want to answer all the questions that we ask. The opposite is often also the case. The patient tells you too much. These patients can start to take control of the conversation, or they relay to you too many details and a surfeit of information that has no relevance to what you are asking them about. This is a problem because you only have a limited amount of time set aside for each patient, and because it can be very exhausting as a therapist to spend so much energy staying focused and trying to steer the conversation back to the topic. Patients with heat in the heart are typically problematic in this way. Heat in the heart means that they are over-communicative. Their Shen can have difficulty distinguishing between what is relevant and irrelevant, and it cannot control how much they open up to others. What they say may have relevance for the diagnosis, but often they begin to talk about something other than what you ask them about. It is, of course, an important diagnostic sign in itself that they are talking and telling you so much. It is perhaps only this and the red tip on the tongue that tell you that they have some form of heat in the heart. Once you have established this, it is important that you gain control of the interview again. It is important to learn how to cut people off in a polite and courteous manner. This can be difficult because they might feel that what they are telling us is relevant to their situation, or that they are paying you to listen to them. It may also be that what they are telling us has a great deal of relevance to their imbalances, but that we do not possess the relevant therapeutic skills to help them as a counselor. This could, for example, be a woman who says that she has been subjected to incest or rape. This will be an extremely important etiological factor, but after we have listened and sensed how it affects and has affected her, it is not our job as an acupuncturist to provide her with psychological counseling. We are not qualified to do this. We can offer empathy and we can give her the space to talk about it, but we must also be conscious of where our therapeutic tools and skills start and stop. In these situations, we must refer the client to others who possess these skills. We can, importantly, help her on the energetic level, and people who have undergone several years of counseling often experience a therapeutic breakthrough as a result of acupuncture. This, though, is through the actions of the needles and herbs and the space we create, not through our abilities as amateur psychotherapists. Respect, sensitivity, and being non-judgmental are key words when interviewing clients. The patient must always feel that you have respect for them, that they can trust you, and that you do not judge them. The latter is something most clients are excellent at doing themselves, and they do not need any additional help. It is a great leap for some people to contact an acupuncturist or herbalist, as this is something that they may perceive of as being alternative or even mystic. It is important that they understand why we ask so many questions that can seem irrelevant and even strange. They may well have thought that it was enough to say that they suffer from migraines, that you would then stick some needles in the headache point, and that would be all. It is therefore a good idea to explain how in Chinese medicine we are constantly looking for patterns and relationships rather than isolated symptoms. You should explain to them how ostensibly disparate symptoms and signs can relate to a specific organ's functioning. For example, that the soreness in their knees and their tinnitus can relate to the kidneys, and that these signs, therefore, have relevance in the treatment of their night sweats, something that they have been told is hormonal. It is also important to inform the client of the difference between the Western medicine and Chinese medicine concepts of the internal organs. For example, when we say that there is an imbalance that relates to their liver or heart, this does not mean that they have cirrhosis or that they are about to have a cardiac arrest. We must explain to them that organs in Chinese medicine are more about functional relationships than physical structures. Thank you for your attention.